For this section, we're going to be talking about the utility of different tissue types and their collection. In some cases, the analysis of tissue may be preferred. That would happen when, in some situations, when there's insufficient volume of blood to do the testing, we may start screening in a tissue sample and hold the blood sample for any confirmation testing. In the liver, if you had to pick a tissue where you wanted to do tissue testing that was not blood, I would start with the liver. Liver, many drugs become concentrated in the liver relative to blood. There's also better reference ranges for drugs in liver than probably other tissue types. Kidney is a good companion sample for heavy metal poisoning. Also, if there's insufficient blood or no blood for carboxyhemoglobin and cyanide analysis, spleen squeeze or spleen itself is the preferred tissue type for that analysis. And lung can also be tested for inhalation of volatile substances. So again, in the tissue samples, you're really looking for a companion sample for blood, or in the absence of blood, other samples where the suspect agent may be concentrated.
This is Dr. Catanese again. We're going to discuss how to submit tissue samples from an autopsy with good technique and practice. I think one thing to make sure is that the autopsy station is very clean, so you don't mix specimens when they're submitted. Like as the organs are removed, most of us do an organ by organ dissection. And then the specimen should be cleaned. So there shouldn't be gastric contents or large blood clots stuck to the surface that might end up in the specimen container. If you're submitting a liver or lung or kidney, the only thing that should go into the specimen container are those parenchymal portions of the tissue from that organ. So for instance, the liver would be cleaned at the surface and put on the cutting board, and then would be serially sectioned so you can inspect it for any disease processes or lesions. And when you take the sample for submission in the specimen container, you want to make sure you don't get a lot of connective tissue or fatty tissue or other things on the surface of the liver submitted into that container. You want just liver parenchyma. If the liver contains a tumor, you don't want to submit the tumor. You want the area of the liver that is just liver. If there's an abscess, you don't want to submit the abscess. And the same goes for the kidney, and the lung and the spleen. See, in submitting skeletal muscle, it's important once again to get a clean sample. Like what I would usually do is go to an internal muscle, cut into it, and then take a portion of internal muscle to submit. In situations where there's markedly decomposition or I guess areas of significant external injury, and you don't have much more to submit but skeletal muscle, you certainly don't want to submit areas that have been exposed to the environment. So once again, you cut deep into the muscle area and try to submit, fresh or rather clean areas of muscle if it's fresh in that case. If not, decomposed muscle is fine, but just try to get it void of debris or anything that was contacting the surface.
For more information about this topic, visit nmslabs.com.